Hello, my name is Chelsea Hancock, and I'm going to be sharing my experience at the long-term care facility. During my experience at the long-term care facility, I got to witness geriatric care on all units of the facility, and I realized that there can be a lack of compassion sometimes with geriatric care due to the high rates of burnout. CNAs and nurses are under a lot of physical and mental stress. And while I was at the facility, I witnessed patients that had dementia, and they would say things or do things out of their control. They cannot control these things. They don't know what they're saying or doing half the time, and it puts a big mental impact on the personnel that's working with them. And many don't remember to eat, so the CNAs are having to feed 3 times a day. I witnessed stroke victims that required a lot of physical one-on-one care because they were unstable. They had impairments, either one side of their body was weak or both sides. um, so as a result of this experience, I will now find ways to relieve stress and to prioritize self-care, so in the future when I step into practice, I won't be burnt out, and I'll be able to give my all to my patients and let them receive the best quality care they can have. Patients within the long-term care facility required more interaction and one-on-one care because many of them have had strokes or physical impairments that have left them being unable to care for themselves, like changing, washing, feeding, and things of that nature. So we see in the hospital, many patients are able to care for themselves. They're able to do these activities of daily living by themselves. So it's less strain on the nurse or the CNA or the tech. I applied the clinical judgment measurement model by recognizing physical and emotional cues within my patient. My patient had limited mobility due to having a stroke, so she was impaired physically to get up out of her bed and come do the activity we were doing. We were doing a craft. So I gathered the crafting supplies and headed back to her room and assisted her with making the craft, so she was included. I established my patient's goals using the nursing process by assessing their needs every time I went inside their room. So one of my patients had a doctor's appointment that day, and I assisted the patient with a bed bath, and I was changing him, and I noticed that he had some skin breakdown. So I applied some skin barrier cream, and the patient felt much relief afterwards after the application of barrier cream. I embrace cultural diversity among special populations within the long-term care facility by actively listening to all my patients. I learned so much about my patients' beliefs and morals just by letting them talk to me and just listening without any interruptions. During my long-term care experience, I gained deeper compassion for geriatric care while feeling a lot of stress because I was under so much pressure, and many of my patients had physical or cognitive impairments that consumed most of my time. I felt like I was stretched thin at some points, but I also thought about, what if this was my family member or my mother or my father or grandparents? Worked with the CNA hand in hand, assisting with bathing, dressing, and changing patients' soiled linens. I felt like a lot more tasks were accomplished quicker than just working one-on-one. Promoted effective communication during my rotation by establishing good rapport with patients. My patients were able to trust me and open up to me. So I was able to learn so much about my patients just by establishing that good rapport and trust within my relationship. 3 ways my nursing skills expanded during this clinical experience was that I felt more confident being on a time schedule with completing tasks for a patient. I can now accurately perform a head-to-toe assessment, and I have gained more confidence performing manual blood pressures. My experience at the long-term care facility has enhanced my role as a student nurse by showing me that nursing can be so challenging at times, but it is so rewarding to establish those strong relationships and trust with patients. I also learned how to collaborate and work as a part of a team in the healthcare setting, which this will be vital later on when I step into practice. Overall, this was a great experience. I got to see another side of nursing care, and I was able to build confidence within multiple areas that I needed that extra practice with. So thank you all for listening.